My presentation will cover the policy processes, and within the presentation, the technology will be interspersed. Actually, it's not a high-profile presentation. I'll be taking you to the grassroots of Tamil Nadu, how the PHCs are performing, the government hospitals are performing, and what are the various policy measures which was initiated and has been continuously being initiated in the state of Tamil Nadu regarding the health workforce, use of technology, and the various processes involved in it. Basically, I'll just go into the health profile of the state. If you see, the state has got 62.4 million. This is based on the 2001 census. Very highly urbanized state. 44% of the state population is urbanized. Quite a remarkable female literacy. If you see the birth rate, it's 16.10. Here, I'll just like to mention about 2 points. One is the infant mortality rate, which has shown a decline in the past 10 years. And next is the maternal mortality rate. Though in 2001 we started off with 111, in 2008-9 we have around 79. This is one of the major challenges which we are facing. The state is facing, and we are trying our best to do whatever we can. Regarding health system management, we have a strong political will, a very committed bureaucracy. Very fortunately, maybe some may argue on this, we have only one principal secretary looking after the health sector. In many states, there are two secretaries. There's only one principal secretary looking after the health sector, and they're very technically sound administrators working in the health sector. Here, I like to point out one particular thing which has got similarities with Gujarat as well, is the dedicated public health cadre, which is a very important thing for public health management. Because if you go into the prevention is better than cure model, we have to have a strong public health system. If you are totally dependent on the clinical one, which is not cost effective. Various cost studies have told us the prevention model is the best and not the other way. So for prevention, if you take the prevention as a policy measure, we have to have a strong public health cadre. So this is the basic organization chart of how the health department. You have the minister, the secretary, the secretariat, the special secretary, joint secretary. We have the DPH, the directorates, AIDS control, the secondary level hospital, DMS, Tamil Nadu Health System Project, the medical college institutions, NRHM, not a medical service corporation, which I'll make a mention later in my presentation. As far as the governance is concerned, I mentioned the first point. The second is we have a Tender Transparency Act, which makes the transparency in procurement. Actually, this is a basis in which the Tamil Nadu Medical Service Corporation was formed, and all our tenders are done in a most transparent manner. And we have also decentralized decision making at the level of the deputy directors, in some cases even at the level of the MOs of the PHCs. And as far as the transfer counseling, these are some of the policy measures in making the health workforce function better. There is a transparency in transfer policy. There is own counseling, like that. The vacancies are put up, and people opt for it, and whoever is the senior most gets it. And we have very strong public-private partnerships with NGOs and private sector, especially the Kalina insurance scheme, which we floated last year. It is completed 1 year. And the 108 ambulance services, and in the field of HIV as well as tribal welfare, we have strong. We have NGOs working, and these two, especially the 108 and insurance sectors, are very strong model to be emulated. As far as service delivery is concerned, we have shown an increase in infrastructure in all components. One good mention is all our PHCs have got an computer with internet connectivity, and all our data regarding the HMIS is uploaded at this computer directly to the server which we have at ELCOT, which is managing the servers at present. This is the upgradation of the past 10 years. If you see the infrastructure, we have a variety of centers. We have the CMONG center, which provides comprehensive emergency obstetric and newborn care centers. We have around 124 centers. The basic emergency centers, PHCs, blood storage facilities. All this involves a lot of technology. Cold chain management for storage of blood, establishing of blood storage center itself is a complicated process where some licenses needs to be obtained. And we have provided semi-auto analyzers to nearly 950 PHCs, and we are going to provide to all the PHCs in the near future. We have state-of-art ultrasonograms in 806 PHCs and X-ray facilities in 257 PHCs. As I told earlier, all PHCs are connected with, are provided with computers and internet connectivity. If you see the service delivery mechanism, very importantly, we provide 24-hour delivery services in all our PHCs with 3 staff nurses working around the clock. And maternal death and infant death is reviewed by the district magistrate very religiously. And we have the emergency transport through the EMRA 108 ambulance services. For the pregnant woman, free transport is provided by this ambulance. And very importantly, we have this Dr. Muthulakshmi Reddy maternity benefit scheme, provides some cash incentives for the ANC and the PNC mothers. And we also have the birth companion program. These are a few documentations. This is the state of, I won't say all the PHCs, but most of the PHCs in the state of Tamil Nadu. This is the pregnancy cohort which has been entered on a weekly basis. This is the AN counseling given in the village. Then we have something called the bangle ceremony. In Tamil it's called Valagappu ceremony, where before the 8th or 9th month, the pregnant mothers are brought to the clinics, and they are basically, the first photograph shows they are brought to the clinics and all the facilities are shown to them, so that conference as a confidence building measure. And this bangle ceremony is done so that through this mechanism, through this process, we improve our institutional deliveries. This is the district collector who is actually serving food for the pregnant mother. And as I told you, free ambulance services for the pregnant mother. This is the interior of the ambulance. With some vegetable gardens and gardens to really upkeep the PHCs are done. The patient waiting shed. Wherever possible, if you see there's an AIDS red ribbon there. So wherever possible, wherever public gather, we demonstrate our IEC materials. We have solar heaters. Television is provided in every PHC. There's something called maternity picnics, which I told earlier, where people, the ANC mothers are brought in to the facility and shown what are the various facilities offered. Some of the initiatives with the Tamil Nadu Health System project is the public-private partnership with the EMRA. We have also entered into public-private partnership of providing mortuary van services. Last year, the Honorable Minister announced that all over the state, in addition to the ambulance services, we will be providing free mortuary van services to the public, especially from people from the hospital to the cremation shed or to the house. For the increasing our OP and providing a good interface between the patients, the illiterate patients, as well as the hospital, we have appointed nearly 555 patient counselors in this 185 counseling centers. And equipments and consumables are provided by through Tamil Nadu Medical Service Corporation. And the last 3 years, we have really constructed maternity wards, OP blocks in 225 hospitals worth 274 crores. I would like to just mention these 2 schemes. As rightly pointed out by the keynote presenter, NCDs is the biggest problem in our country. Now we have a lot of proof establishing double burden of disease. So through Tamil Nadu Health System project, we initiated the pilots, 2 pilots, one for cervical cancer and one for CVDs, controlling risk factors for prevention of CVDs. We found that especially for CVDs, if you invest around 124 rupees per person in that particular district, you will be able to prevent many of the risk factors pertaining to CVD. The same was the case with cervix, it was around 128 rupees, whereas the treatment was much higher. So we selected, we are now upscaling. We got a World Bank funding of 627 crores. We are upscaling from 2 pilot districts to all these districts in the state at the cost of nearly 150 crores. I think some of the technology which was deliberated in this particular meet could be used, because we would be covering nearly 62 million people. Because everybody would, it's not, we have a particular age group, but the messages would reach to everybody, the workforce, the labor workforce, the students. So if you're dealing with such a large population, I think there's a technology is required, and that particular technology will help